psychological and physical support to the most vulnerable in informal settlements amid the coronavirus pandemic. Solutionist Thinkers is a group of medical doctors, nurses, psychologists, psychiatrists, and even social workers who first raised the alarm of racial profiling by medical aides in 2019. The group recently provided their medical services to residents in the Diepsloot informal settlement in Soweto. Here, they distributed face masks, sanitisers, and food parcels. They also taught young and old about COVID-19 and how to use a face mask correctly. And joining us now is Nomaefese Gatsheni, the founder of Solutionist Thinkers, and Dr. Maudi Lydia to talk about their initiative. Ladies, a very good morning to you. Thanks for joining us. Welcome to Morning Live.
Good morning, Simpiwe. Good morning to the viewers. We thank you so much for inviting us in the program.
Okay, Nomaefese, I'm going to start with you. There are so many organizations that have awareness campaigns who are distributing food to the vulnerable. So what makes Solutionist Thinkers initiative different from the others?
I think what makes us different is that we are a group of healthcare practitioners. So we kind of reaching out to all areas or aspects of the communities. Talking of the healthcare, not just distributing food vouchers, but the focus was more also on psychosocial support, also on screening and teaching people about COVID.
Dr. Lydia, let me also bring you into this conversation. Please elaborate on the counseling rendered by the group to the most vulnerable. How does it work and how do you identify those who need help?
In the case of the initiative Simpiwe, what we did was we looked at the most vulnerable around us and we went on with Diepsloot to say that they actually, in this case, are at the most need because they are in their squatter camps. And if you go there, you can see that they actually don't even have yards. One house is next to the other house. And they even use public toilets. The whole community use public toilet. So it's very difficult for them under the circumstances to actually adhere to what the national call is expecting of them to do. First, they cannot social distance. They are unable to actually provide food for themselves because most of them are in the informal business sectors, which could not operate throughout the lockdown. So they are in a financial crisis. They are struggling with hunger. And it was very important for us to go and support them emotionally, encourage them, teach them how to actually do some of the things properly, like how to wear a mask, and give them what they can use to actually assist them and be hopeful throughout this crisis. So we actually just provided emotional support. We have educated them. We have shown them how to use masks properly. We have shown them how to wash their hands properly. And they were actually very happy. And I think that's services that the people in our communities need because they are fighting bread and butter issues.
Yeah, speaking of bread and butter issues, you've just mentioned that some of the problems that they're facing is the loss of income, is hunger as a result of being locked down for almost 3 months now. So what are the common psychological problems that they go through that you had to grapple with?
The common psychological issues that we see a lot now in the period of COVID-19 is all of us, including all normal people, we are in distress, we are in emotional distress, we are uncertain what's going to happen tomorrow. We don't know how long we're going to be in this thing. And that on its own provokes anxiety. So you can imagine having other social challenges, like in this case, people who are in informal settlements, they are having financial loss as well. People losing their jobs and all the other problems that's coming with the pandemic. So
Hi, Nomaefese, are you still with us? Okay, yeah, we seem to have lost our ladies there. That was Nomaefese Gatsheni, the founder of Solutionist Thinkers. She was also joined by Dr. Maudi Lydia, a psychiatrist, talking to us about their initiative to counsel and help the most vulnerable in informal settlements during this pandemic. She did point out that some of the common issues that they are faced with is the loss of income and hunger as a result of being in lockdown for the past 2 months or so. And we do apologize for the break in transmission there. But we'll take a quick break now. We'll have more in a moment.